Oral sex has been identified as a significant contributor to the increasing incidence of oropharyngeal cancer in the United States, according to Dr. Hisham Mahana, a professor at the Institute of Cancer and Genomic Sciences at the University of Birmingham. Mahana referred to this trend as an epidemic, with the number of cases of this type of throat cancer rising rapidly over the past 2 decades in both the US and the UK. The main risk factor for oropharyngeal cancer is the number of lifetime sexual partners, particularly oral sex. Those who have had 6 or more lifetime oral sex partners are 8.5 times more likely to develop oropharyngeal cancer than those who do not engage in oral sex. Human papillomavirus, HPV, is the most common sexually transmitted infection and is responsible for approximately 70% of oropharyngeal cancers in the U.S., according to the Centers for Disease Control and Prevention. While many people with HPV will not experience any symptoms, for others, it can develop into cancer. The number of oropharyngeal cancer cases linked to HPV increased by 1.3% in women and 2.8% in men annually from 2015 to 2019, according to the American Cancer Society. While people with HPV infections can often clear them completely, a small number of people are unable to do so, possibly due to an immune system defect. In these individuals, the virus is able to replicate continuously and integrate into the host's DNA at random positions, which can cause cancerous growths over time. It typically takes years after being infected with HPV for cancer to develop, according to the CDC. The agency also acknowledges that it is uncertain if having HPV alone is enough to cause oropharyngeal cancers or if other factors, such as smoking or chewing tobacco, interact with HPV to cause these cancers. Researchers have found that having multiple sexual partners, especially oral sex, can increase the risk of catching HPV and, in turn, developing mouth or throat cancer. A 2021 study discovered that people with 10 or more oral sex partners were over 4 times more likely to develop HPV-related mouth and throat cancers. According to data from the CDC, 41% of teens between the ages of 15 and 19 participate in oral sex, and young people ages 15 to 24 accounted for almost half of the 26 million new sexually transmitted disease infections reported in 2018. The HPV vaccine is currently aimed at preventing reproductive cancers. However, a UK study found that the country's female-only vaccine regimen could significantly reduce HPV-related oropharyngeal cancers. The CDC confirms that the HPV vaccine also provides protection against the strains of the virus that cause oropharyngeal cancer. In the U.S., 11 and 12-year-olds are advised to receive 2 doses of the HPV vaccine, and individuals aged 9 to 26 are approved to receive it. As of 2020, only about 54% of adolescents had received the vaccine. Thanks for watching. Please like, comment, share, and subscribe.